WAJR and the AJR News Network welcome you to Wellness Wednesday, North Central West Virginia's premier medical talk show, presented by Fairmont Regional Medical Center, the only hospital in West Virginia to be recognized 4 years in a row as a top performer by the Joint Commission. Now, here's your host for Wellness Wednesday, Kyle Wiggs.
And good morning. It is a Wellness Wednesday for mid-October, already the 14th of October. Wellness Wednesday, sponsored by Fairmont Regional Medical Center. And our guest this morning is Dr. Michael Ferrebee. He's an emergency medicine doctor at Fairmont General Hospital and a WVU med school graduate. Been at this for nearly 30 years, including, almost 2 decades as an ER physician, right?
Yeah, that's correct. Yeah, I did a variety of things from internal medicine to pediatric critical care at WVU for a few years, and ended up being in emergency medicine almost 20 years now.
All right, you're here to talk about. We'll get into some of those aspects, the emergency medicine, and I know there's a lot to brag about in terms of the emergency department at Fairmont Regional, in terms of how people are cared for and the time it takes to get in and out of there.
Yeah, we actually last year we were number one in the state for the time that takes to be seen by an emergency room physician, and the time to disposition from the time you register and time to be disposed either to home or to a room was second in the state, and so we're pretty proud of that.
All right, we can get into that a little bit later on in the program. Again, there's a lot to brag about in terms of Fairmont Regional Medical Center. But on top of your list is preparing people for fall. And I come to work very early in the morning, and the last few mornings, today was a little bit warmer, but yesterday morning it was 42 degrees.
Yeah, it's I heard the weather's supposed to be only in the 50s here this weekend. So.
What we're getting at is it's almost we're gonna enjoy fall here for another month hopefully, but it's almost winter, and people need to be prepared for when the weather turns and illnesses and how to avoid getting sick the best you can.
Yeah, health is associated with seasons. And, we're getting ready to go into flu season for both adults and kids. In kids in general, we have croup season, which I always describe as Labor Day to Thanksgiving. It's football season is croup season. And we've been seeing our fair share of croup in the evenings. But it's time to prepare for, the fall and winter, and knowing that the heaters are starting to come on, the air conditioners are turning off, and associated with that, you get dryness in your air, and so it's always important to keep humidity in your house. One of the things that we frequently see is an increase in nosebleeds, and with a lot of the elderly and adults who are on blood thinners or platelet inhibitors for their heart disease, they're at risk for nosebleeds, and specifically when it gets dry in your house. So one of the things you can do as a fall preparation is to get a Cool Mist vaporizer and stick it near your bed at night, and that may help reduce nosebleeds.
Is that a big cause of headaches as well, the dry air?
Absolutely, and it's a cause of headaches. It's a cause of, our throats love moisture, and so it's a cause of why most of us have a scratchy, sore throat as it goes into fall and winter, because we all typically sleep with our mouth open, and there's really no way around that. We all do, and it dries out the mucosa. So one of the key things is keeping humidity in your house.
What is it safe to say that perhaps the most important thing to do to prepare for this type of season is to get the flu shot?
Absolutely. It's been over the last several years, the flu vaccines have been made even more available in the latter part of summer. September, people are starting to have flu shots available. We're finding that because it is sporadically showing up in our state and in the region. It starts showing up middle of September. We've already had our first positive flus in the emergency department this last week. We started testing a couple weeks ago, but we've had our first positive influenza A's just this last week.
Wow, that's a little bit scary. I mean,
Yeah.
that's alarming. It used to be that they'd run out of the flu vaccine, but it seems to be more readily available. And again, you used to have to go seek it out, but now employers have health fairs. A lot of pharmacies, a lot of the corner pharmacies, you can get the flu shot there. You can come, I would imagine, to your facility and get the flu shot. It's available. You just need to take the time and go get it done.
Absolutely. And, there were a lot of issues with flu vaccines and egg allergies and variety of allergies. They have become more and more specified. They now have a flu vaccine for people who have egg allergies. You just have to request it and find out if your clinic has that. There's a trivalent flu shot. There's a quadrivalent flu shot. That means that the trivalent is covering influenza A, two different strains, and type B. The quadrivalent is covering 2 type A's and 2 type B's, which they are anticipating being the flus that are going to be the predominant strains this year. The other thing that they have is a flu mist for kids. If their aversion to needles prevents them from getting a shot, which most kids are, and a lot of adults too, there is the flu mist that's available. So there's a lot of different resources out there for basically the vaccination.
Now, you get the flu shot, and it is a little bit of a guessing game. You were telling me that last year was about, 50% of the cases?
It was under 50%.
But still, if you get the flu shot and and you get a different strain that still makes you sick, that vaccine is going to, I can testify to this personally, that vaccine is going to make the symptoms more manageable, and it's going to lessen the duration that the time that you're sick with the flu.
That's correct. Yeah. Having the flu vaccine on board, what we find is that the majority of people who get the flu, especially last year, had a much milder case.
Yeah.
And there's a lot of evidence to support that occurs.
I got the flu shot last year, ended up with the flu, but it wasn't near as bad as it's been in years past. So, I mean, we can't emphasize enough to go out and get that flu shot. Now, it's not that you have enough to worry about in terms of what you do overseeing the emergency medicine department, but you also pay very close attention to the weather.
Yes.
The weather. How does that play in?
Well, a lot of our illnesses are related to the weather, and there's a lot of history behind weather-related pandemics and epidemics. Specifically with the flu, there's been an association with El Nino and La Nina, and if you look historically, in World War I, 100 million people died of the Spanish flu, and there was a strong El Nino at that time. So as they look back historically, a lot of the pandemic influenza seasons were associated around an El Nino or a La Nina, which is when the Pacific Ocean gets cooler. And they are believing it's related to the birds' migration, which most of our flus are aviary or avian in nature, which they originate from the bird, or come from the swine, which is the pig. Mm-hmm. But it is strongly associated. So it's going to be interesting how things are going to play out this year because, as we're seeing on the news, it's a very strong El Nino, and they anticipate that's going to last all the way through the winter, which will make our area. It looks like it's going to be a warmer climate and maybe wetter. So it may play a role. It definitely El Nino affects the entire world with dengue fever, which doesn't affect us, but there is an increase in the plague, which we've been seeing out west in the southwest parts of America. The rodents produce more when El Nino's around. So, and actually there's an interesting fact, there's more snake bites associated at the time of a strong El Nino. I'm not sure why that is, but
That is interesting. I guess if it's wetter, they have a tendency to wander
Go
out
out and
more.
look for food.
Right.
You know.
If it's drier,
Yeah.
I don't know. That is an interesting phenomenon. We are with Dr. Michael Ferrebee, or emergency medicine doctor in Morgantown, and you live in Morgantown,
I
but
do,
again, your
yes.
primary you work with obviously Fairmont General Hospital, Fairmont Regional Medical Center. One of the things we can touch on this briefly and then move on, but it's striking to note that, and you deal with this a lot in the emergency room, with the amount of overdoses, and it's really striking to note that more people in this state and in several other states, probably the majority of states, there's more people that succumb to drug overdoses now than automobile accidents. That's an incredible statistic.
It's very sad, and it's an epidemic. It's a silent epidemic. Any of us who work in the emergency departments around the region all are fully aware of the epidemic that's occurring with our younger generation. There's a lot of addiction issues. There's a lot of recreational use, and some of them are accidental overdoses. Some of them are intentional. There's it's just a very sad situation. We lead, unfortunately, in the country in several categories related to prescription drug overdoses, related to Percocet, hydrocodone, all of the Suboxone, all of the medications that are out there. In addition, there's heroin, there's cocaine. It's very sad, and we have to, all of us have to address it on a daily basis.
Mm-hmm. Do you see this starting with the prescription medication, whether someone gets it out of their parents' or grandparents' cabinet, they get a hold of it somehow, and then as that becomes too expensive, that's when you turn to the street drugs, the heroin?
Yeah, actually, there's so many variety of ways for it to occur. It can occur from an injury that they may have had, or associated with a family member, but it's readily available in the community.
What can we do, if anything? I mean, what do people need to keep in their minds, keep aware of?
Pay attention to family members that may not be acting their normal selves. Ask them about it. Don't avoid it. Talk about it. It is dangerous. I mean, there is a lot of states now are looking at making Narcan, which is a reversible agent, available, and we use it very frequently when somebody comes in who has an altered mental status or is unresponsive, and it is a quick turnaround. They wake up if it is an opiate that is causing but sometimes it's not an opiate. It can be it could be a polysubstance overdose.
Mm-hmm. We're with Dr. Michael Ferrebee, Fairmont Regional Medical Center, sponsoring Wellness Wednesday for this October the 14th. We're talking about getting yourself prepared physically, getting your body prepared, trying to avoid sickness as we go into the fall and winter portions of the year. We'll take a break. Our conversation will continue. Stay with us.
Now back to Wellness Wednesday, presented by Fairmont Regional Medical Center on WAJR and the AJR News Network.
Fairmont Regional sponsoring Wellness Wednesday. Dr. Michael Ferrebee is with us, an emergency medicine doctor. And doctor, we talked about adults and children preparing for the fall and the winter, getting the flu shot. Another thing you see a lot of is the stomach illnesses, the stomach viruses. What's the message there in terms of preventing that and perhaps dealing with that before it gets to the point where you have to go to the ER?
Yeah, one of the things that you frequently see around the holidays is you start seeing the stomach viruses, foodborne illnesses come into play because everybody's eating, a late Thanksgiving, and they might be eating the turkey 6 hours later, and or the next day or 3 days later, and they come back in and have nausea, vomiting, and diarrhea. And one of the things that you really want to do is take your leftovers and put them in the refrigerator. Don't let them set out. I mean, most people know that in the summertime when you're there in the summertime, but you have to do that in the fall and winter as well, because if it's been sitting out for 6 hours, at 70 degrees in your house, it's the same as 70 degrees in the summertime. So it's one of those things from a preparation standpoint is put it in the proper storage and refrigerate it. The other thing that you want to do is if you do start feeling down is, make sure you have some electrolyte type fluids around. Gatorade, Powerade. I always say the sports drinks are ideal. A lot of people will try to just sip water or ginger ale. Those are okay, but it's still better to have electrolyte substances like Gatorade or Powerade. Even with children, a lot of parents try, the Pedialyte. Well, Pedialyte's is fine. If you have a 2-year-old that doesn't like Pedialyte but they like Gatorade, Gatorade's fine. You can give them the Gatorade. It's not gonna harm them. The other thing that you want to do is just making sure they stay well hydrated. Most of what we see in the emergency department is if somebody comes in and they're dehydrated, we'll give them some IV fluids. But we also have available Zofran or Phenergan, and Zofran is probably the treatment of choice this day and age. Phenergan has got a lot of side effects that we try to avoid in kids and adults as well. But good hand washing and making sure your food is properly stored.
And heated.
Yeah,
heated up.
And heated.
If you're going to eat, even if it's properly stored in the refrigerator, make sure it's good and hot.
Right.
Kill all that stuff in there, hopefully, if there's anything going. So it's pretty simple. Wash your hands, get the flu shot.
Yes.
If you get anything out of this conversation today, keep your hands clean and get a flu shot, no doubt.
Good hand washing.
Doctor, you talked about earlier, and it runs on the promo each and every time we do Wellness Wednesday with Fairmont Regional Medical Center. We talk about the emergency room being the best in the state in terms of time in, time out. What are the keys to that?
It's multifaceted. It's a team approach. You have to have everybody bought in, from lab to radiology to registration to nursing. You've got to have everybody on board that's trying to be efficient. And our goal is to get them through registration quickly when they're in the emergency department. There are times when it's busy and that doesn't get met. That goal doesn't get met. But most of the time we are able to get people on average in and out. And our lab is very effective. Our labs typically are returned in 20 to 30 minutes time from the time they're drawn. And our radiology reads are good. So it's that's really, if you've got everybody on board, you can get people evaluated and assessed and
treated.
Make them in and out.
Yeah.
Which everybody's time is valuable. So
that plus the fact that if you're in the emergency room to begin with, you feel miserable.
That's correct.
Something hurts, you're sick, something's broken.
Yeah.
And if the less time there, the better. I mean, you can only make it worse if you're sitting around for several hours waiting. But it's a credit to you and to your facility that you're noted for the quick turnaround.
Yep. Hopefully we can keep it that way.
All right. Very good. Well, Doctor, we appreciate your time, and I guess it probably gets busier for you.
Yeah, I think our busy time is usually from now till April or May when things start settling down. But like I said, it's seasonal. In the summertime, you get the injuries.
Right.
You're out and you get the injuries. We will start having the slips on ice and those kind of things. So that's the other thing to watch out for is patches of ice. That's one of the last things I could say to watch for when you're walking around this time of year.
All right, very good. Dr. Michael Ferrebee, part of the award-winning emergency department at Fairmont Regional Medical Center. They sponsor Wellness Wednesday. Thanks for your time.
Thank you.
For Dr. Ferrebee, I'm Kyle Wiggs. Thanks for listening to Wellness Wednesday.